want to share some big health news with you today. It's in the battle against breast cancer. A simple blood test in the future could predict a woman's risk. As of now, there's no reliable way of predicting the likelihood of non-inherited breast cancer, but for the first time, researchers have identified a way of discovering whether a woman is at risk even if there are no genetic predispositions. Instead of looking for mutations, they look at changes in how the DNA functions, specifically the BRCA1 breast cancer gene. Now, this is an important development because a lot of breast cancer cases do not come from inherited mutations. Joining us with more on this is Dr. Stephen Narod, Women's College expert on breast cancer genetics. Doctor, let's talk about this test, which of course doesn't exist yet, but the research is showing that we could one day have this kind of test. How would it work?
Well, certainly there's an interest in blood tests for breast cancer, and some tests are designed to identify little cancers before they're felt or seen on a mammogram. That's one kind of test, but this test is specifically designed to identify women who may be at high risk of cancer. We have blood tests for identifying women at high risk of cancer, which is like BRCA1, BRCA2, which are designed to look at genes. This is the first test which is proposed to look at not the mutations in the genes, but how the genes are regulated. What's interesting is looking at white blood cells and saying that the changes in the lymphocytes or the white blood cells actually predict changes in the breast, which may lead to cancer. It's certainly something which many scientists would find interesting, and if it comes into a clinical test, that might be really wonderful, because all of us, in medicine who deal with breast cancer and genetics and public health would like to be able to concentrate our efforts in prevention and screening on women who are at high risk of cancer from the outset. So currently we can't really do that very well. We have some rare instances like BRCA1 where 1 in 200 or 1 in 300 women are at high risk of breast cancer. But mostly we offer screening to all women. We consider all women to be at risk in Ontario. About 9% of women ultimately get breast cancer.
So
a test like this.
Yeah, how far in advance could you take a test to see this kind of prediction, to see this kind of change in the white blood cells?
Well, we haven't really done that, but the idea might be 20 or 30 years. The idea here is that what we can see in your breast cells or in your white blood cells today might predict your risk of breast cancer well into the future. This particular study, they showed about 4 years on average prior to the breast cancer that the changes were there. They didn't really look at the whole range of years, but possibly could be 10 or 20 years. Would that be worth knowing? Well, not on its own. You have to be able to have other ways of preventing cancer, but we do have tamoxifen. We have, in some cases, women at high risk get preventive surgery. So a lot of work would need to be done between there and now. We're certainly a ways away from recommending women with a positive test preventive surgery. Also, we haven't really defined the risks. And it would be very important if your test was positive, exactly how high is the risk. If it were to be 80%, that would be similar with the BRCA1 mutation, and all options would be on the table. If the risk would be low, for example, 20%, then our preventive options might be more restricted, for example, to having intensive surveillance or having tamoxifen. So there's first thing would be to actually confirm that this test is reliable in other populations, and secondly, to actually do the clinical studies. Is it acceptable? Is this something women want to know? Is this something useful? And can it be coupled with really valuable preventive procedures such as tamoxifen, etc.?
Okay.
Doctor, it's a wonderful...
Sorry, I'm sorry to cut you off, but we are out of time, so we do have to leave it there. I appreciate your time. Thank you for joining us, Dr. Stephen Narod.
Thanks for asking me. Good afternoon.